I think there are two types of studies that I'm very keen on seeing data from. One is we have been talking to, and I think as our other myeloma doctors and other doctors in general, with the manufacturers of passive antibody strategies like monoclonal antibodies against COVID. These are being made by Regeneron and Lilly and other companies and are actually approved for patients that have been detected to have infection as a way of preventing the patient from getting sicker. But these would be excellent prophylactic strategies, which could be given very similar to what we do currently with IVIG. We give it monthly to our patients. And I think the companies are interested in rolling out studies like this. I believe my colleagues in the UK have already started enrolling patients on these sorts of studies. So this is something which will complement the booster effect. And for the patients that still don't mount a booster, a response after booster, maybe protect them from getting severe complications of COVID. So that's one type of study that I'm very interested in. The second type of study that I think we will all need to do is follow and see how sustained these responses are. In our own experience, at least in terms of the patients getting anti-CD38 antibodies, their levels were not as high on the vaccine after 2 doses of vaccination, but if they remained on the drug, the levels actually dropped off far before healthy controls did. So the sustained effect of these maneuvers is also something that is an urgent and important question, because the FDA, for example, has recommended getting a fourth dose of vaccination 6 months out. But for some patients, maybe 6 months is too far. We don't know that. And we will need to prospectively study that, study the T cell response, and really understand if they are marching together, as we saw in our initial report, or if there's a divergent as time goes by.